Hello there. Thank you for joining me today as we look at our topic of adopting the electronic health record, also known as the EHR, looking at the issues, challenges, and achieving desirable outcomes. To get started, healthcare information technology, also known as HIT, enables achieving outcomes involving population health. For example, looking at increasing access to care through electronic access, looking at increasing access between varying organizations, also looking at maintaining more accurate data keeping, etc. This brings us to the EHR itself, which falls under HIT. An EHR may be defined as an electronic/digital collection of patient and population data, which can be shared through healthcare information networks, exchanges, or across varying healthcare departments and organizations in order to be utilized to increase the patient continuum of care and use of evidence-based data to make clinical care decisions. Now, in our today's topic, we will be able to gain an understanding of the history of adopting the EHR, to then get an idea of the key issues and challenges in adoption, which may be addressed, to then offer solutions to achieving the desired outcome of EHRs, increasing community health outcomes. First, it's important to look at the history of the EHR. Really beginning in the 60s, the Mayo Clinic developing the basis of EHR evolved into large health systems adopting EHRs, spreading then across departments, to then spread across large organizations, to then moving to the IOM reporting the value in EHRs, really focusing on the quality side of care, moving forward into the Bush administration mandating the adoption of EHRs across American health systems, which brings us to our statistics of today of close to 90% of medical staff being in compliance with the EHR adoption, and therefore seeing an increase in community health. It's also important, however, we do see that we haven't reached 100% compliance, and this can be due to a few key issues we do see, starting with the issues upon adoption of lack of compliance for medical professionals, which is understood. Using paper records has been the norm in healthcare for decades upon decades, and when medical professionals see the complexity of technology, they don't seem to understand the value over what could be simple with paper records. Another issue we see is the fact of distinguishing past data from being just data, but to also be used to give insight into future health outcomes. And the last issue we have seen is the cost to implement. For example, to implement an EHR for one physician can cost over $100,000, a fee that most physicians are not able or unwilling to afford at this moment in time. Next, we see the key challenges which strongly impact EHR adoption today, really starting with interoperability. This is really the idea of having EHRs and data branch and flow between various organizations. However, the main issue we see is that EHRs are now responsible for achieving this aspect, but were not intended to do this. EHRs were created to move data between one organization. However, now that the support of them is really focused on between various organizations, the question is, should EHRs still be the main reliant, or should we introduce a new HIT? Next is the issue of usability. For example, medical professionals, like we recently talked about, are hesitant to utilizing EHRs. This is a big issue in terms of education, with staff not understanding the use of it. And lastly, health IT safety. Anything from potential data breaches to incorrectly sharing some patient's information with someone that should not have gained the information is definitely at a higher risk when you're using technology and have a greater flow of information. However, we do have the HIPAA law and data security checkpoints in action right now, but the question is, when these do not perform as they should and these data breaches still do occur, is EHR adoption truly the best option for us? Now, with these challenges and the issues we've seen in recent years, we have some recommendations that fall under the categories of drivers, policy, and technical components. Really starting with the drivers, as we have noticed in terms of our issues, a big part of it is education. So a big driver is going to be implementing educational programs for medical professionals and patients. This is going to offer the ability to really support and look at all stakeholders, ranging from researchers, physicians, healthcare executives, community members, to make the use of EHR aware, to give individuals a reason to use it other than being told simply to use it without any explanation. The second recommendation we have is to really increase policy. Looking back at the mandation under the Bush administration, which skyrocketed EHR use up to 90%, to gain that other 10%, another use of a new policy, which would really look at a new HIT to complement EHRs would be a great solution. The third recommendation we have is looking at the technical component side of things. So looking at 24/7 EHR support to really give those physicians that are weary about using EHRs that support, to understand that they are not alone and that they will constantly have somebody to walk them through the steps. But at the same time, this will also help increase technology awareness and help gain a greater support for EHRs so that we can all move together towards that goal of population health. So to conclude, after looking at the issues we face and also the recommendations we have, from discussion of the history of EHR adoption, we can really see that through offering these recommendations, the desired outcome of increasing EHR use to then increase population health can be achieved. The EHR main adoption issues consisted of lack of compliance, distinguishing data, and implementation costs, and we also have the main challenges today consisting of relying too much on EHRs for interoperability, a lack of education, and potential data breaches. However, if we do instill those educational programs, a new type of HIT, and 24/7 support, we can move this compliance with using EHRs from 90% to 100%. Thank you very much for being here with me today. Here are our references that we have used in this presentation, and I hope you have a good rest of your day. Thank you. Goodbye.